easiest way for us to get it. Our whole culture has shifted away from that outdoor agricultural existence, and we're now indoors, or we're clothed. And even tanning, people are not as much interested in getting a good tan like they used to. The whole fear factor has entered in. And so, interestingly enough, there is a website, and by the way, this article that you have at your place is going to be a pretty good mirror of what I'm going to be talking about today. So if you want to go back and review some of what I'm saying, it's pretty much in the article that I wrote. And I wanted you, if you have a pen, or if you can remember, there's a website called Vitamin D Wiki. Vitamin D Wiki. I was going to have you write. It's in the article if you don't have a pen, but write down Vitamin D Wiki, and I'm going to kind of show you a slide from it. But you can get a tremendous amount of information there. So I'm hoping all of you will become students of vitamin D, because as you notice on this slide, not only is it important, it's the number 3 most important thing you can do for your health. Now, I would also say don't forget the other things. And one of the big mistakes that I see in the research on vitamin D is that studies are often done, let's look at vitamin D compared to placebo as if it were a drug. It's not a drug. It still is a nutrient. You'll be interested to know that I think it's much more than just a vitamin, and we'll talk about that in just a bit. But keep this in mind for your overall health and well-being, prevention, better quality sleep, normalization of weight, lots of things that we can talk about in terms of vitamin D. So as Dr. Ann mentioned, why do we have this kind of discomfort? Why are doctors so concerned about people overdosing vitamin D? And there's a bit of a fear factor involved. And I was kind of wondering this myself, especially when we get into all the incredible benefits of vitamin D. Where did this fear come from? And there's probably a couple reasons, but I dug this up, that back in the 1950s, I was born in 1951, vitamin D was kind of taking off, and then all of a sudden some people developed hypercalcemia and high levels of vitamin D, and they couldn't figure out what it was, and they decided that vitamin D is actually very dangerous. It turned out that it's a type of a diagnosis called Williams syndrome, where certain people, 1 in 7,000, lack a certain number of genes, and that causes hypercalcemia in vitamin D. And so there was from the very beginning, there was an onus surrounding vitamin D. And even though the correct diagnosis was made in the 60s, that reputation has never quite left. And part of it's because I went to Kansas University Medical School, and this is the nutrition instruction that we had. 2 hours, one afternoon, we talked about rickets, and we talked about scurvy and, a number of different nutritional diagnoses, but they said, don't worry, you'll never see it. And I think a lot of doctors are still of that mindset with the whole idea of rickets. If you just consume 200, 400, 600 units of vitamin D, you're fine. Why in the world would you want to take more? You're just going to set yourself up for the risk of hypercalcemia. So that particular burden of misunderstanding is with us today. And so part of the reason that I wanted to give this presentation is to kind of talk to you a little bit about how higher doses of vitamin D can be utilized in a safe manner. And so, but I want to build into that and kind of discuss it in terms of four levels of vitamin D. But before I do, let's talk a little bit, that last sentence on this slide where this is the quote from Dr. John Cannell, who is the founder of the Vitamin D Council. This is a group of concerned doctors and citizens who are trying to re-educate the public on the safety of higher doses of vitamin D. And he says, I have since learned that there is little concern at 10,000 units a day, and the toxic level for long-term use is about 40,000 units per day. So I'm going to talk to you a little bit about how possibly you might be interested in doing something like that, but you want to do it in a way that is safe. And so we have developed a program at the Reardon Clinic, which we call the Reardon Monitoring Protocol. That's the other sheet that you have, and I'll be explaining that just a little bit more. But here's why so many people are experiencing vitamin D deficiency type symptoms. And there are 38 reasons why people are vitamin D deficient. But as you can see, we're getting less sunshine. The food quality that we have is such that there's less vitamin D in the food that we're eating. And some of the really important cofactors like magnesium, there's a huge magnesium deficiency in the American diet, and stress and sugar and different things are depleting our reserves of magnesium, and people are not always getting enough of the omega-3 fatty acids. And then there's these blocking genes that are coming up that I'm going to talk a little bit more about. VDR, which is the vitamin D receptors that cells have that could be a factor in why people are witnessing, or we're all witnessing, a rise in chronic illnesses. There's a major paper that was published about 7 years ago that shows that in the last 25 years, there's been over a 10-fold increase in chronic illness. And so when you get together with people, more often than not, they're talking about this person with cancer, or that person with autoimmune disease, or chronic fatigue syndrome, or migraine headaches, or depression, mood disorders. All of these things can be indirectly tied to vitamin D deficiency. Not to say that vitamin D is the panacea that cures everything, but it's a major factor that can be corrected rather easily. Obviously, sunshine is one way to do it, but using vitamin D supplementation safely can be another really important way. I mentioned that vitamin D wiki, this website is phenomenal. And you could I don't know if Paul got it set up, you can very easily click on, you just type in vitamindwiki.com and you can get to it. I wonder if I can just quickly, sometimes the computer will let me do this. Let's see. Control click. Let's see if it takes me there. And if it doesn't, that's all right. It's just a phenomenal website. On the left-hand column of the website, it has 125 different conditions that are related to vitamin D deficiency. And for each condition, there can be anywhere from 10 to maybe 400 or 500 related research articles. And so from that website, you can get to all of those particular research articles. So no matter what condition you might have, it'd be worth your while to check out how it could possibly be related to vitamin D deficiency. And so also on that website, it doesn't show up very good on this slide, but it shows up all the main reasons why we're experiencing so much decreased vitamin D. People are indoors, kids are playing video games, we're afraid of the sun, we're aging. As we age, we need more vitamin D, not less. There's less magnesium in the food. You need that to activate vitamin D. Certain chronic kidney diseases, diabetes, that increases our need. All these autoimmune diseases are related to vitamin D deficiency. Anyway, I could go on and on just to let you know that it is documented that there is definitely a vitamin D deficiency epidemic going on in the world. Then throw in all the myth understandings about vitamin D. So these I'm sure you've heard of, that really you only have to spend about 10 or 15 minutes in the sun and you'll get all the vitamin D you need. If 200 units is all you need, then maybe yes, you might get that if you're out in the sun. A lot of people are afraid, though, to expose themselves too much for fear of sunburn and skin cancer. So then just eat fish 3 times a week and your vitamin D will be adequate. A lot of fish is farm-fed, and so the amounts of vitamin D in fish are not as good as what they used to be. The really good fish, the sardines and the oily fish, a lot of people don't really like. You can get all the vitamin D you need from food. The foods have changed. People are eating less dairy, less milk. So the vitamin D in milk is actually vitamin D2, which is not as potent as vitamin D3, so that's not great. A daily multivitamin, that will have about 200 to 400. And again, we're thinking that all we need is enough to prevent rickets. Well, we don't really have a lot of rickets epidemics going on, though it is on the rise, interestingly enough. So all of these misunderstandings, people are worried, okay, you're going to get more kidney stones. You have to take a lot of calcium if you're going to take a lot of vitamin D. And really, it's the opposite. So you should reduce your cholesterol, but actually you need cholesterol to make vitamin D. People who are taking statin drugs and their cholesterols are way down, the way you make vitamin D out in the sun is from cholesterol in your skin that gets converted to a pre-D. And by the way, I'm for all of you who have tried to study vitamin D and heard about how it works as a hormone, I have taken special care in this lecture that I'm going to help make all of you experts in how vitamin D is formed in the body. So these are the three levels, and I'm counting the vitamin dose level as level 0, because really most of us are covered when it comes to the vitamin dose of vitamin D. You really need somewhere between 200 and 400 international units of vitamin D, and that I think we're getting. We don't hear of a lot of kids having rickets, though the research is that some kids are starting to show signs of rickets if they just never go outside. Rickets was discovered back in England when the very poor children, they had these overcast days and soot in the air and the sunlight wasn't getting through and their diets were awful. These kids were getting rickets. And so vitamin D was actually the fourth vitamin that was discovered because it was found it was a compound that actually cured rickets. And so I've got this slide up here. So oftentimes just as little as 200 units a day will prevent rickets. The first vitamin that was covered was vitamin A, and then came B1, berry. Scurvy was vitamin C. So vitamin D was the fourth vitamin that was discovered, and that was over 100 years ago. And back then, the whole concept of a vitamin was that it was a small amount of a molecule or a substance that was present in food that would prevent a specific disease. So in the case of vitamin D, it was rickets. The problem is that we found out that vitamin D is much more than a vitamin because we can make it when we're out in the sun. So that automatically takes it out of the realm of just being a vitamin. It's really more like a hormone. And so this vitamin concept, however, has stuck with the medical profession, and it's stuck with the boards that set these so-called safe levels. And so if you just get enough, then you're fine. And so what it's ignoring is some very important benefits at higher doses of vitamin D. And you say, well, why would we ever want to take higher amounts of vitamin D? And my answer to it is think of our ancestors 100 years ago, farmers who were out in the fields working all day, even housewives who were out growing their gardens. And the fact that we didn't have air conditioning, people didn't want to stay indoors as much as they used to. When I was a kid, we played outdoors all the time. What do kids do these days? They've got their video games and they've got their computers and the iPhones and whatnot. Fortunately, we've got things like team soccer and things like that where kids are getting more sunshine. But in general, we have become more of an indoor society. And so we don't get that 10, 20, 30,000, maybe 40 or more thousand units. I've heard that lifeguards can get as much as 40 or 50,000 units of vitamin D a day when they're out in the sun most of the day. So we're not getting those big doses. But genetically speaking, if you look at the whole process of evolution of humans, we did get that. We were an outdoors creature. It may be that even when humans migrated from Africa to the northern parts of the world, we lost the skin pigmentation so that we could get more vitamin D, because this vitamin D does some very interesting things to improve the functioning of all of our cells. And that's what I'm going to be covering here in just a minute. So this is really getting into the second level of how vitamin D functions. Matter of fact, I even kind of don't like to call it vitamin D, but D3. This is how D3 functions, is that it's made in our skin from the sun. So in 1937, they couldn't really think of it so much as a vitamin, but we still do refer to it as vitamin D. So it's made in the skin with UVB light. And this is why tanning booths have been used. And it was interesting about I think it was about 10 years ago, there was an article in the Wichita paper about this one girl who had become addicted to tanning. Do you remember that, hearing about people that become addicted to tanning? They're not addicted to tanning. They're addicted to how much better they feel when they get extra vitamin D in their system. It's a great antidepressant. Of course, sunshine is a great antidepressant, but part of that may be because it raises our vitamin D levels. So let's talk a little bit about vitamin D as a hormone. It's synthesized in the body. So what I'm going to do, and I was really excited to do this because all through medical school and even here at the Reardon Clinic, there's been other times when we've given lectures on vitamin D, and I always get confused about how vitamin D is made by the body. So this is my attempt to take you through kind of a visual picture of how we get our vitamin D. So if we're really out in the sun a lot, we can very easily get 30,000 units of vitamin D from the sun. So, but if we hide underneath the umbrella, or we put on a lot of sunscreen, they say if you cover up with sunscreen and you're out on the beach, you're only getting 5% of the vitamin D that you would otherwise get if you're using sunscreen. So again, I'm not promoting people going out there and getting burned. I think you do have to be careful. But nevertheless, we are losing out on the ability to get the benefits of vitamin D. So if you do get enough sunshine, what happens is in your skin there is a type of cholesterol that will form what's called pre-D. And then from foods, you actually do get vitamin D3, or from supplements, you do get vitamin D3. So you can see that there are 3 ways that we typically get vitamin D. But that 500 units, this is what they're estimating the typical person in America today gets in terms of being out in the sun, about 500 units, not nearly as much as our ancestors. So we have to depend upon getting vitamin D from food. Now, some of the meats that we eat, because the cows and chickens some of them are out in the sun, not all of them. Some of them are coming from types of farm-fed situations where they don't get as much sun. But the ones that do, they contain either vitamin D or they get the activated form of vitamin D. So we're getting a little bit more vitamin D from food than we once thought. Vitamin D3 from supplements, usually people get it in the form of a multivitamin. There might be about 200 units there. Dairy, if you consume a lot of butter, you might be getting some extra vitamin D if those cows were raised in the sun. So this is the D3. This is vitamin D. But once you take it and it gets into your bloodstream, what happens to it goes through the liver. And there, vitamin D3 is converted. And this is chemistry talk. A hydroxyl group is added, and it becomes 25 hydroxy D3. And the reason I want you to recognize that, if you do go to get your blood tested to see whether or not you have adequate amounts of vitamin D, this is the number that you'll get back, or this is the test that the doctor will order. It is a 25 hydroxy D3. But this, however, is not the activated form of vitamin D3. And there are a number of different standards as to what is considered normal. Instead of me going into that, that's what's on this monitoring sheet. It kind of tells you what kind of levels you can get from 10,000 units per day. That's 60 to 100. We had the good fortune of working with an NFL team about 2 months ago in Kansas City, and we found an article where they had tested all of the members of this one NFL team, and their typical vitamin D level, the average level, was 27. And so you wonder, well, they should really be thinking about this because vitamin D can help them improve the quality of their bones. And for us Kansas City Chief fans, we want our quarterback in good shape. So I would like to get him to take some vitamin D and not have these injuries. And so NFL players are not getting enough vitamin D, in my opinion. So anyway, this is how we measure it, though. And there are certainly standards that are followed, but most doctors are happy if you're around 40. If you're less than 20, then they'll say you're deficient, you better take some, maybe 2,000 a day. But you can certainly get up into the 50s, 60s, 70s, 80s, completely healthy. No questions asked, just that a lot of doctors are not comfortable with it. But so you want to watch and see what your vitamin D level is. And basically these are the mechanisms that most people use to get that level up. Now, obviously, you can take a lot more than 200 units. And one of the interesting things about the current situation is that you can go out now and you can go upstairs, and we have 50,000 units, we have 10,000 units. You can take what you want, but a lot of people are cautious, and you should be cautious. There is a safety factor. Vitamin D can be overdone. No question about that. So part of what I'm kind of going to help you understand today is what are your safe levels, but can you get more benefit from these higher levels than what's typically recommended? And that's where I want to take us today. So the next really important step is this step 6 is where this 25-hydroxy-D is processed through the kidneys. And it's what's called activated. And so the activated form of vitamin D is this calcitriol down here at 1,25-dihydroxy-D3. So we just call it calcitriol. So there are actually, if you followed me, there's that vitamin D, there's this vitamin D, there's the D3 that we call, that really is vitamin D, and then there's the pre-D. And that's what has always gotten me confused. But actually it's just a process of transformation that the body takes it through. And for example, if you've got a kidney problem and you need more vitamin D, the nephrologist will probably give you a calcitriol shot. But normally that's not what we use. Normally what we take is vitamin D3. So what happens when your body does convert the vitamin D to calcitriol? Then it will act upon the intestines, and you will absorb more calcium. So that's one of the big benefits of vitamin D. As a matter of fact, that's probably the main function of vitamin D, is that it helps you absorb more calcium. It can also, if you get high on your dose of vitamin D, it can take calcium out of your bones. But the main thing is that vitamin D helps us maintain calcium homeostasis. And this is why women especially, as you get older and you're concerned about osteoporosis, you need to make sure you're getting enough vitamin D. And so there's always this, say, am I getting enough or am I getting too much? And so part of what we want to do today is help you kind of get a better understanding of what's enough or what compared to what might be considered too much. So this is all going on just for the sake of helping you to absorb more calcium from your diet. That's really on this kind of level 1, vitamin D as a hormone, that's what vitamin D does. Now, if you understand what I just said, that's what your doctors understand, is that vitamin D is a vitamin and vitamin D is a hormone. And as a hormone, what it does is it pulls more calcium into your body. And their thinking is if you take higher than the recommended dose, you're going to have trouble with too much calcium. You're going to get calcified arteries. You're going to get kidney stones. You're going to get problems with excess calcification, maybe in your joints, for instance. And there, of course, you can make that happen. And I'll just insert right now, the reason it does happen to people who take too much vitamin D, more often than not, is due to a lack of vitamin K2. Now, I want to talk just a minute about vitamin K. I don't have a slide on this, but vitamin K is not potassium. How many of you have heard of Kalo? That's a mineral, potassium. Vitamin K is a fat-soluble vitamin, and it's not K1. K1 is what your body uses to regulate coagulation. The whole coagulation scheme was discovered in Sweden, where the word coagulation begins with the letter K. So that's why we call vitamin K1 a coagulation vitamin, but it doesn't have anything to do with calcium. K2, and especially MK7 and MK4, they have to do with calcium. And what K2 does is it makes sure that the extra calcium that you get, for example, when you're taking vitamin D, goes into your bones and into your teeth and not into your tissues. okay? Because a lot of the diseases that we experience, especially cardiovascular disease, you can go in and get a calcium score to check the coronary arteries of your heart, and they're looking for how much calcium has built up in your arteries. And people that have that, I can tell you right now, they probably don't have enough vitamin K2. So one of the things that we've done here at the Reardon Clinic, now we're back onto safety, is that the 10,000 vitamin D3 capsule that we have upstairs always has vitamin K2 in a 100 microgram dose. And by getting vitamin K in an adequate amount, whenever you take vitamin D, you almost automatically prevent the problem that many experts are concerned about. Not only do you prevent the problem, you improve your bone health, you improve your teeth health. So it's the appropriate utilization of calcium is exactly what we need to do. People taking large amounts of calcium, like oftentimes women with osteoporosis will be put on 1,200, 1,500 milligrams of calcium without anything being said about vitamin K2. Because most doctors, when you mention vitamin K, they're thinking you're talking about coagulation. But K2 has to do with proper calcium utilization. So when we say that vitamin D is very important and that we can use it at higher doses, here at the Reardon Clinic, I never prescribe vitamin D without that ratio of 10,000 of D3 with 100 of K2. There's a number of places in the literature that points out that that is the safe ratio to prevent inappropriate calcification. So there's your safety factor right there. So what happens if your calcium starts to go up? Well, there's another gland in your body called the parathyroid glands. There's actually 4 of them on the backside of your thyroid, so they're parathyroid glands. What they do is they are a counterweight. So you let's say you're taking more vitamin D and you're absorbing more calcium, the parathyroid hormone will go down. But if you're not getting enough calcium in your diet, the parathyroid hormone will go up and it will pull in more calcium from your bones and from your digestive system. So we've got these two forces, vitamin D in your diet or as a supplement or as sunshine, and we've got parathyroid hormone regulating calcium from your bone. And the problem with a lot of people is that if they are not getting enough calcium that's being utilized properly, the calcium will be pulled from your bone and you start developing osteoporosis. Now, there are other reasons. There are other hormones involved. But this is that dynamic interplay between vitamin D and parathyroid hormone. And we're going to come back to this because this is also a way when we start going into higher levels of vitamin D that we can monitor to make sure that we're not doing any damage. You can very easily monitor your serum calcium level by getting a chemistry profile, and you can also monitor your vitamin D level. That's easy to do if your doctor won't do it. There are labs now that you can do it. We do vitamin D levels here for the public, anyone that wants to check that. And so you'll notice on this monitoring sheet, I have recommendations here. For example, at the 10,100 D3K2, I'm just suggesting a vitamin D level every 12 months. We've never seen anyone develop a problem taking this with their calcium. And what we see is just many, many benefits. People who are on this dose have fewer colds. They have a much lower incidence of flu. There's a number of benefits just from this foundation dose. And this is also recommended by the Vitamin D Council. The Vitamin D Council really does not count vitamin D toxicity until you get up to around 150. Now, that's not the standard of conventional medicine. That's the standard of a number of doctors and experts who have been really carefully looking at vitamin D and basically trying to get the word out that we're missing out on a fabulous preventive nutrient, hormone, and molecule that can actually upregulate the functioning of your cells, which I'm going to get to here in just a moment. So the job of the parathyroid glands is to monitor your calcium level. So as it says here, if your calcium goes up, your parathyroid hormone is going to go down. And so if that's the case, this is the counterbalance between the activated vitamin D. And if you're saying, well, how do I know what I should do? Don't worry about it, because your body does this for you in an automatic kind of way. It's only if you have, for example, a parathyroid adenoma, which is a growth on one of these glands, does it kind of foul up. And we do sometimes see people that have elevated calciums because they're making way too much parathyroid hormone. So this is the opposite side, that if your calcium level is going down in your diet, or your vitamin D level is low, then your parathyroid hormone will make more parathyroid, or your parathyroid glands will make more of this hormone to pull the calcium out of your bones. But if that's out of balance for a long time, if you have a poor diet and a lack of vitamin D over a long time, you're going to start losing a lot of valuable bone calcium. You want to keep the calcium in your bones. That's kind of like your calcium bank, and you want to have good, sturdy bones. So also a number of functions within the body depend upon a calcium level in your blood. Your heart functioning requires a level that's even. If it gets too high or too low, you get into arrhythmias and other problems. So the calcium level in your blood is very important, and we've got these two systems that are constantly balancing us. So that's done automatically. But if you do a chemistry profile and you do a vitamin D level, you can pretty much rule out if there is a problem or not. So this is looking at the whole schema, and so you can see how the sun plays a role. You can see how our choices in terms of how much exposure we give ourselves to the sun. We want enough that we don't burn, but we want more to get better vitamin D levels. Or if that's not going to work, we can look to food, but food can only give us limited amounts. So the major way that we have available to us Western modern people is vitamin D supplementation. Now, even the best doctors who recommend higher levels of vitamin D supplementation almost always say, try to get some sunshine, because there's something about sunshine that's even a little better than the vitamin D in a bottle. And I think all of us know that. I don't know, I just feel better being out in the sun. Just walking over here, being out on a day like today is good for our health. It's good for our sense of well-being. And vitamin D itself can kind of create that and help sustain that for you in just general times. Now, your liver quality, that can be a factor. If you've got cirrhosis or you've got some other serious liver disease, that can be a factor in why you're not getting proper levels of vitamin D. But you actually measure this form of vitamin D, the 25-hydroxy-D3. That's where you kind of use that as your touchstone to see just exactly how you're doing. And we'll talk a little bit more about that when we get into level 2.
What if you take milk thistle?
I'll take questions afterwards. Okay. Milk thistle is a good thing for your liver, of course, but it's not going to really affect it unless you have problems with liver disorders. But milk thistle is very good for your liver. So I know maybe this was helpful, maybe not, but generally speaking, this is how your body regulates calcium. And vitamin D plays an important role, but the parathyroid hormone is also very important. Okay, so if you go away with no information other than this that I'm going to show you right now, if you just, in my opinion, if people would just take one a day of the D3K2, there's a number of different companies that make this, you would be in much better health. This is what I would call the McPill. If you read my article back when Dr. Reardon was still alive and we were in Boulder, Colorado, driving past a McDonald's, he shook his head and he looked at me and said, "It's too bad we don't have a McPill," because the McDonald's concept is spread the world over. And if everyone could just get one of these a day, I could tell you the whole complexion of the healthcare system would change radically, because vitamin D has that potential. Now, not by itself, but with exercise, adequate sleep, the right supplementation, the best food, stress management, all these things really need to come into play. Fresh foods, organic foods. There's a lot of things you can do for your health, but don't forget vitamin D. And so for those of you who say, hey, I heard what you said about the the hormonal aspects of vitamin D, but tell me, doctor, what should I take? In my opinion, you could take this and feel very safe. There's only one exception, and I don't think it's a real exception, but a lot of doctors do. If you're on warfarin, if you're on Coumadin, which because you've had a blood clot or a heart attack or something, and you're on an anticoagulant like warfarin, there is one paper in the literature that says K2 could affect that. And so there is a way to get around that by making very slow adjustments up and down with the vitamin K2. But generally, everyone else would be very well off to just do D3K2 10,100. That's my foundation dose that I think is safe and is important for your overall well-being. So now let's talk about optimal dosing. So this came about in my thinking because I had a patient come in who wanted to do much higher doses, and so I wondered, is this really safe? Well, fortunately, I have been on a board in Canada. It's called the Pure North Synergy Foundation, and they have tested over 30,000 Canadians. They're concerned about vitamin D because Canada is even further north, so they have an even shorter period of time when the sun is ideal for creating vitamin D. By the way, if you stand out in the sun and your shadow is longer than you are tall, you're not getting any benefit from the sun. The sun has to have the rays have to have the right angle of attack to your skin before your skin will generate vitamin D. So that's another factor that plays into why the sun is not always a reliable source for your vitamin D. So anyway, they've tested all these people, and they found it to be, just as the Vitamin D Council has found, that anything less than 150 is generally safe if looked at in the context of the whole person, the whole medical history. And so we have a plan here that if you are unsure about this, we have a program that you could go through if you wanted someone to kind of walk you through the idea of taking this higher dose. But let's talk about what it is. The reason why I'm even bringing it up is because in the last 10 years, we have now found that there's another major level of how vitamin D works to help us maintain optimal health. And this level 2 is where we've discovered that vitamin D is a key intracellular enabler. It's like a key that unlocks the ability of our cells to respond appropriately to environmental demands. And I'm going to explain that in just a minute. This is an article. There's many articles. Fundamentals of vitamin D hormone-regulated gene expression. So vitamin D regulates how your genes express in any given situation. And the new understanding that we're having now is that our cells have a nucleus, and within that nucleus is our DNA, our chromosomes. The thought has been, well, the DNA just kind of sits there, and then when the cell divides, it divides, and that kind of keeps the cell alive. There's a much more dynamic understanding that we are gaining now about our DNA, that the DNA is kind of like a huge hard drive that's got all these little programs in it. And second by second, minute by minute, as we live our lives, depending upon what we've eaten, what our emotions are, how much sun we get, whether we're dehydrated, our body and our cells are responding to these environmental conditions all the time. There are like little programs that occur. And so when something changes, it's a stimulus, and then the cell reacts to that particular stimulus. And vitamin D plays an important part. So the vitamin D I was talking about earlier is in the field of endocrinology. What I'm talking about now is something called autocrinology. What's going on inside the cell? And we found that vitamin D does something really special. It's a part of what we call epigenetics and our ability to respond to stress and other challenges within our lives. So I'm going to use again the example of serum calcium. If your calcium level gets too low, then the brain sends a message, or the brain cell that monitors this will send a message to your parathyroid glands and to the parathyroid cell. And so that's a signal. And so inside the cell, there is an intermediate step which is called an intracellular enabler or a signal modifier. It's a type of molecule that goes from the surface of the cell to the nucleus and then puts in the right code that starts the right parts of the DNA to start making some kind of new cellular equipment, like a hormone. So it's really like a key. And in this case, when your calcium is low and the key comes in, then that cell starts making parathyroid hormone. And when your parathyroid hormone goes up, then you start having your calcium go back up again. So it was low calcium was the stimulus, and the response is that your calcium goes back up again. But it really required this intracellular equipment to occur. And it turns out that the key to making the intracellular equipment work properly is the activated form of vitamin D, which is calcitriol that I showed you earlier, 1,25-dihydroxy-D3. Now that is normally made by the kidneys, but what we found is that only 5 to 15% of this activated D is made by the kidneys. Most of it is made intracellular as part of the body's ongoing response to its environment. So if the intracellular calcitriol is low, and the key, I'm just depicting that as a really small key because you're deficient in vitamin D, then your ability to respond is not as robust. It's a weaker response. And so when you have a better level of intracellular calcitriol, you're able to respond better to the environmental signals and the changes that you need to make in order to adapt to whatever's going on at that particular moment in your life. So having a higher level of vitamin D will enable your cells to respond more appropriately to environmental signals. And this is true for all the different types of cells in your body. This is why when you go to the Vitamin D Wiki website and there are 125 conditions that respond to vitamin D, it's not that each of those conditions have some kind of different thing that vitamin D does. It does the same thing. What it does is it helps the different types of cells in your body to respond more appropriately to stress. So you have a stimulus and you have a response. And so it turns out that if you have robust levels of vitamin D in your bloodstream, in other words, a higher blood level of vitamin D, you're going to have that will diffuse into your cells and it will make more intracellular 1,25-hydroxy-D3, the calcitriol, and that key will allow you to have a more vibrant response to your environment. And so in trying to think about why is this so? Why would the body have this? Well, think back that in the temperate zone, at least, we were much more active during summer months. This is when the farmers were out plowing the fields and haying, and this is when the carpenters are out building houses and we're out maybe making a garden or whatever. Being outside during the summer it's a time of activity. It's a time of challenges, in order to get things done. This is when the body needs to activate, to be more vibrant in its ability to do whatever it needs to do. And so, but during the winter months, when there's less sunshine, we can get by. I mean, yes, our vitamin D levels go down. Now, a lot of people, if they've gotten enough vitamin D during the summer, because it's fat soluble, it's stored in our fat cells. And so we have enough to get through the winter. But for people that are never really getting the high levels of vitamin D, what you end up seeing is that they kind of get in this, what some people are calling a winter syndrome all the time. Winter syndrome, where you feel blah. You start putting on weight because you don't burn your fat as well. You don't sleep as well. You're like almost in a waking hibernation state is what some people have described this as. It's called the winter syndrome. And people are more depressed during the winter. So all of this could be due to the fact that because vitamin D levels are low, you're not getting the cellular response, the intracellular response that you would like to have in order to be more adaptive to whatever's going on in your life. So this is where we say 25-hydroxy-D3 is acting as a cellular function enabler. It's an autocrine function, 85% of the vitamin D that you take, this is how it's utilized. It basically diffuses into the cell, and then when the stimulus comes along, then the activated form of this is what allows the cell to respond appropriately. So this is what I call an optimal dose. And there is a book now called The Optimal Dose where the author who's an MD, has suggested that 30,000 is probably a safe level. Now, he monitored his patients, and that's why in the optimal dose part of the paper that I have, we're saying that you can work your dose up to around 100 to 140 nanograms per milliliter. But we still recommend being monitored by a health professional if you're going to try this. You can do it. There's no one to stop you from doing this, but it's our recommendation that you would have a vitamin D level, a comprehensive metabolic panel every 3 months for the first year, because it is possible that some people, they don't process their vitamin D as well, or they have kidney problems, or they have other issues that may make this kind of a dose not as safe as it should be. So I would recommend that if you're going to try this, that you do it under the care of a physician that is knowledgeable about this kind of dosing of vitamin D. But the dosing is somewhere between 10 and 30,000. And I have some of my patients that I'm actually taking them up a little bit at a time, maybe 5 or 10,000 at a time, maybe to 15 or 20,000, and then monitoring their levels, monitoring their calcium and their their creatinine level. If you get too much calcium, it can build up in your kidneys and slow your kidneys down. I have a patient who is not in the program, and I did not put her on her vitamin D, but she was up to about 200,000 a week, and her creatinine level was slowly going up. And I said, we need to check your vitamin D level, and it was 295. And that's way over the 150 that I was telling you about, or 140. And so we've actually taken her off of the vitamin D. Her calcium was also going up, and her creatinine was about 15% higher than it really should be. So monitoring what you're doing is a necessary part. But why would you even bother to do this? Well, in my article here, I talk about the 3 major things that happen to people who are at the higher dose. Their immune system dramatically improves, and that includes autoimmune diseases, because part of what your immune system does is it uses something called the T regulatory cell, and it can help you get over autoimmune diseases. It also improves people's sleep at these levels. Much deeper restorative sleep when you're at a higher level of vitamin D. And then the metabolism improves. And so people who are stuck in a diabetic state, type 2 diabetes, or they're struggling with their weight and they can't make any progress, it's very possible that you would benefit from a higher dose of vitamin D. But I would say it should be done in the context of someone who's evaluated maybe your thyroid, your other values. And so we have a program that can help you do that if you're interested in that. So that's the optimal dose, and this is the program. Mike Shaw has been with us now for almost 2 years. Mike is a physician's assistant. He has worked in the area of anti-aging medicine. He does our weight loss program, and what we have done since I've written this article is we've added a component to the weight loss program called optimal metabolism. And you can see where we look at the C-reactive protein, the thyroid panel, the vitamin D level, the lipid profile, chemistry profile, and blood count. So we're really kind of taking a more comprehensive look so that you don't get the notion that this is just take vitamin D and everything will be wonderful. It's not quite that simple. But I think it's a valuable addition for people who are struggling and stuck in a rut. And so vitamin D might play a really valuable role for them. Now, the last level, I've just got a few minutes here. I won't be able to go into great detail, but it turns out that vitamin D is a receptor modulator. And there are a number of doctors around the world, especially a doctor down in Brazil, Dr. Coimbra, who is using very high doses of vitamin D under very tight laboratory conditions, and he has been able to reverse MS in about 20,000 people. Really? You have a niece? Okay. Yeah, so Dr. Coimbra, he's a neurologist. He kind of stepped out on a limb. He spends about 3 hours with each patient before he sets them off on this track because it is very high levels of vitamin D. And so, again, I would not recommend it. On my monitoring program, I recommend if you're even thinking about this, you should become what we call a real health discovery patient at the Reardon Clinic, where we take you through a very comprehensive look at your laboratory, making sure there are not other issues that need to be adjusted. I've got two individuals now that I'm working with at this level, but it's one of those things that I think I wouldn't recommend you to do this at home, so to speak. But nevertheless, it's a natural substance. It can be used in conjunction with conventional medicine, but for a lot of people, they're able to get off their medications and reverse things like rheumatoid arthritis, MS, there's a number of colitis, those kinds of things that are very serious autoimmune diseases. So that's the receptor modulation. And the way he does it, just to kind of, since you were talking about physiology, he carefully monitors the parathyroid hormone level. And so he's slowly raising the vitamin D dose, watching calcium, watching kidney function, and he watches the parathyroid hormone level come down. Remember, as vitamin D goes up, parathyroid hormone comes down. But people that have vitamin D resistance, parathyroid hormone doesn't come down until he gets them to the higher levels. And once he breaks through the VDR, the vitamin D receptor resistance, then the parathyroid hormone starts to come down. So he holds them at that level, gets their level down to about the bottom of the normal range. And that's how he very carefully adjusts their dose and gets them to a level that is able to have that intracellular effect start to work again. Because if the vitamin D can't get into the cell, it's not going to work. So this is targeted dosing, and it's available here, but it's something that I would strongly encourage you to do under doctor's supervision. So this is part of the laboratory profile that we do on all of the new patients that come in for more complicated illnesses, such as this level 3. And we really look at everything, all the nutrient levels, all the functional levels, trying to get an understanding of where the bottlenecks may be and to correct those as part of this overall program. Now, I wanted to just let you know, we've got about 2 minutes here. I wanted to let you know a couple of things. We have a new doctor in Overland Park. I don't know how many of you knew that we have a satellite in Overland Park, Kansas. Beautiful office there, the Reardon Clinic in Overland Park. And this Dr. Gail Wheeler is a doctor of osteopathy that has just joined us. She is a fully certified functional medicine doctor. She also has worked extensively with bioidentical hormone replacement. But she told me to say she deals with the whole person, which is, that's right down my alley. Dr. Ryan Hartig has been hired. He has signed his contract. He's coming November the 4th. I'm really excited. He is, in my estimation, a young man, and he's 43, but he went into medical school with the intention of becoming a functional medicine doctor. Functional medicine is kind of the integrative, naturopathic type of medicine where we're looking at biological functions and trying to use natural substances to help people deal with their conditions. And so Ryan will be joining us early November, and we're really excited. I'm really excited to have a little bit of help from another MD here in Wichita. But I don't want you to forget about the other doctor in Kansas City is Dr. Lucas Timms. He's a naturopathic doctor. And then Dr. Moffat up in Hayes is doing a stellar job of covering the North Country. And so all of these doctors are available to help you in case you need specific help in the area that I'm talking about. Because I really want you, the reason we did this monitoring protocol is that I recognize that vitamin D is extremely important, but remember, safety first. And so that's why in even offering a program like this, we want people to know that they should be using services like the Reardon Clinic where our doctors are specifically trained to manage this type of a program. One last note, and then we'll take some questions. The lovely lady that introduced me is Dr. Ann Zotterer. And she is our number 2 daughter, which of course she says she's really number 1. Dr. Ann has been with us for 7 years. It has been the delight and love of my life to have her working with us. She has 3 beautiful children of our 6 grandchildren, and we're so glad they're the 3 that are here in town. We love being with them. Dr. Ann is just being run ragged with those 3 kids and is getting a little tired and is now going to take a break. And so unfortunately, for those of you who haven't heard, Dr. Ann will be resigning her position come the end of this month. And she's going to take a couple months off to figure out, to regather herself and to figure out what her next step is. Every child eventually leaves the nest. This is just the bigger nest that she's left, but it has been such a joy to have her work with me. And for those of you who heard us lecture together, we do this kind of mind meld thing. We think very much alike, and so anyway, we'll really miss Dr. Ann, but she'll probably still be available in one way or another. So, thank you, Dr. Ann. Okay, with that, are there any questions? We're right at the top of the hour. And I'll stay around for another 10, 15, 20 minutes if you have questions. And Ann's going to let you speak into the microphone here so we can catch on to. By the way, this is being recorded. It's on YouTube, and if you have someone that you would like to see the lecture, it's available on YouTube. If you go to Reardon Clinic and subscribe, it'll be right with our lunch and lecture agenda. Yeah, go ahead.
This one is so simple, I'm sorry to use the mic for it, but you were talking about the waking hibernation state, and it sounds like what we used to call SAD, the seasonal affective
disorder. Yeah, I really think it is. That's a very good point. I've been talking to patients about this, where they, this seasonal affective disorder, where people get depressed during the winter, and they try to sit under lights and try to feel better. If they would just get their vitamin D level up, I think that would take care of it, because vitamin D is a true antidepressant.
But then you called it the something syndrome that started with a W, and I didn't catch that.
I just was using the idea of the winter,
okay.
or the winter hibernation syndrome. Basically, that the body thinks it's in wintertime even though it's not winter, and people just are sluggish and putting on extra weight and just not being their full self. And just think of when I was showing the intracellular calcitriol levels go down, every cellular function kind of goes down. It's like the idle of the engine just kind of goes, no matter what you try to do, it's just not full potential. You get the vitamin D level back up again, and you're going to be functioning at a higher level. If you didn't know, I'm taking 30,000 of vitamin D, so I'm kind of up here like a maniac, so I apologize. Yeah. So yes?
How much magnesium?
Well, that's a really good point. And if we go back to my original slide, magnesium is number 4 behind the vitamin D. It's a very, very important nutrient. And so people who are going to do higher levels of vitamin D should be taking magnesium supplementation with it. And so Mike Shaw is certainly very much aware of that. And anyone that we're going to put on a higher dose, we're going to make sure they're getting adequate amounts of magnesium. Well, it depends on the type of magnesium you're taking. The question is how much, and it depends upon there's a number of different forms of magnesium. I usually tell people to try to take at least 400 milligrams a day as just a baseline. Citrate is fine. It doesn't absorb as well as some of the other forms, and so, yeah. Yes, back there, Ann.
There's so many brands out there and so many different things, and I know they've done some testing on lots of vitamins where they don't actually have what they say in them. Is there a list of reputable? I know
you'd have to look for it online. I know we use Biotech as our source, and they are that's their whole focus is vitamin D. It's their whole focus. May I ask for the people that's left here, how many people take 5,000 milligrams of vitamin D at least? And I'm going to just kind of, okay, most people do. Okay, how about 10,000? How about more than 10,000? How many people take more than 10,000? Yeah, we've got several people. Okay, very good. Okay. Any other questions? Here we go.
Is the 10,000 is the 10,000 units of vitamin A a day plus 100 units of vitamin K2 regarded as generally safe for about everyone without monitoring for those who either won't come to the clinic or can't afford it?
Yes. Yes, yeah. So both A.
Yes.
Are you talking D or A?
D.
Well,
I'm
D
sorry.
or A, 10,000 units would be considered safe.
Mm-hmm.
Yeah. You get up into the 25,000 of vitamin A. Pregnant women, there's a concern about pregnant women and vitamin A, but for most people, even 25,000 would probably be okay, but 10,000 would certainly be fine. And same way with vitamin D. I'm saying that vitamin D at 10,000, I regard as safe from my perspective. Now, the one exception was the person that's on blood thinner. That should be dealt with on an individual basis.
How does the vitamin K affect the liver?
So the question is, how does vitamin K affect the liver? And basically, vitamin K, I think you're thinking maybe of K1. K1 has if the liver is in bad shape, it can't process and make K1 properly, and a lot of people that have liver problems will have coagulation problems. When we're talking about vitamin K2, that's almost like a whole nother vitamin, and its sole purpose is that it regulates the proper placement of calcium in the body. So if you've got adequate amounts of vitamin K2, you will put excess calcium in your bones or in your teeth and not in your tissues. There's a very interesting article in the literature about vitamin K that the author tries to make the point that true vitamin D toxicity is not directly hypercalcemia. It's that as you raise your vitamin D, if you're not taking vitamin K and your body's taking in more calcium, the vitamin K will be used up to the point to where it stops. You don't have any vitamin K left to properly dispose of your calcium, and so then the calcium starts showing up in your arteries and in your in your brain and different places that calcification shouldn't occur. And so it's kind of the same thing, but generally speaking, I tell people vitamin K is just a really important component, and it's on that first slide that I showed as being really an important part of overall health and well-being.
I'm curious if you can share a little more information about a couple of foundations and doctors that you talked about earlier, specifically the foundation in Canada that you said you were associated with. Is there a website or something that we can look at?
I think if you type in Pure North and then Synergy, SYNERGY, I was going to bring I have a 3-inch notebook with all 40 of their published studies in it. And so I've been with them for over 12 years. They make a big deal out of vitamin D. Their goal has been to try to change the Canadian Medical Institute of Medicine guidelines as to what is a safe dose. So far, they have not been successful. I mean, it's really hard to get people out of the groove of the idea that high-dose vitamin D is dangerous. It is if it's not used properly, but if it's used properly, it doesn't need to be dangerous.
And then the Dr. Coimbra that you talked about a while ago,
in my article, I have a reference to a book that was not published by him, but was published by another Brazilian doctor that is very readable. He breaks down exactly what the Coimbra protocol is. And Dr. Pintos is also mentioned. He is the doctor from Portugal that also uses high-dose vitamin C for MS. And so this Dr. Pintos cured his son of, what was it that his son had? Anyway,
ALS.
ALS. And what he only uses the 10,100 ratio. So when he takes his patients up to like even 100,000 a day of vitamin D, that would be a full 1,000 of K2. By the way, K2 is safe at just about any dose. There's no toxic dose for K2. So he just keeps his patients in that ratio, and he has found that he's had no problems at all. He does a lot less testing than Dr. Coimbra does. Dr. Coimbra, I think, is probably better at overall safety, but Dr. Pintos has had very good luck using the D3K2. So those are listed. Those books are listed in the article. Hey, thank you very much. Get some sun. Get some sun. Free vitamin D.